everyone, so let's move towards our today's topic, which is
urinary bladder. Okay, now we will talk about in this lecture, like I said, urinary bladder. What is urinary bladder? Urinary bladder, as the name indicate, it is the organ of the urinary system. Okay, and the point is that it act as a reservoir of urine, or reservoir for urine. Why? reservoir मतलब स्टोरेज. ठीक है, यूरिन जो है किडनी में फॉर्म होता है. द यूरिन इज फॉर्म्ड इन द किडनी, देन इट एंटर्स इनटू द ब्लैडर थ्रू यूरेटर. इट एंटर्स इनटू द यूरिनरी ब्लैडर. Then from urinary bladder, when it fills around 300 ml or around 350 ml of urine will be present. Then after that micturition occurs. That means the whole urinary bladder will be emptied. And how it emptied, there is a whole process which I have discussed in a separate lecture. So through urethra, what happened? Through urethra, the urine will be exit out of the body. So this was the overview. Now we have to know what is urinary bladder and what is the anatomy of the urinary bladder. So it is tetrahedral in shape and it consists of apex, base, 3 surfaces, superior left and right surface, 4 borders, anterior, posterior and 2 lateral borders. And not only this, the most important thing, what is the capacity of this urinary bladder. So overall, if I talk about the overall capacity, so total the capacity is basically 500 ml. 500 ml 500 ml यूरिन स्टोर हो सकता है. कहाँ पर? यूरिनरी ब्लैडर में. बट होता नहीं है. अगर ये हो गया तो पेनफुल हो जाएगा, पूरा यूरिनरी ब्लैडर फुल हो जाएगा. सो व्हाट हैपेंड नॉर्मली आफ्टर 300 ml, our urinary bladder, the muscles of the urinary bladder around the bladder, the muscles which are present around the urinary bladder will be stretched. Okay, and the wall of the urinary bladder will be stretched, due to which the reflex will occur and the micturition process start, which I have discussed, like I said, in a separate lecture. But that process usually occurs at 300 ml urine. लेकिन कैपेसिटी, टोटल कैपेसिटी क्या है? 500 ml urine. Now first of all, we will talk about apex. Apex is present for anteriorly. It is directed forward and it is attached with the umbilicus, the belly button, and that umbilicus is attached with the urinary bladder through a ligament called as median umbilical ligament. We will talk about the ligaments in after a few seconds, but the point is you have to remember that the ligament which is connecting the umbilicus and the urinary bladder is median umbilical ligament. Then base of bladder, which is also known as fundus. So in female it is near the base of the bladder. In female, vagina is present, whereas in male rectum is present. Okay, if I talk about the neck, so it is present inferiorly. It is the inferior most part and the constricted part. And one more point, that is that it is the most fixed part of the urinary bladder. It is not movable और इसमें कोई shape change नहीं होती. जबकि अगर मैं बात करूँ, हाँ ये बात मैं बताना भूल गया, one thing I forgot to tell you, that the whole urinary bladder is irregular in shape, but when it empties, that shape will be tetrahedral. ओके, यूजुअली जो आप डायग्राम में देखते हैं किसी बुक वगैरह में, तो वो जो डायग्राम होती है वो टेट्राहेड्रल यानी एम्प्टी यूरिनरी ब्लैडर होता है. लेकिन अगर यूरिन फिल हो गया है यूरिनरी ब्लैडर में, दैट विल बी एन इरेगुलर शेप which is of urinary bladder. Okay, now ऑब्वियसली नेक जो होता है यूरिनरी ब्लैडर का, वो कनेक्टेड होता है, वो कंटिन्यूस होता है विद द यूरिथ्रा, एंड फ्रॉम यूरिथ्रा ऑब्वियसली इट एग्जिट आउट ऑफ द body, it exit out of the body. Superiorly, the bladder consists of peritoneum, and inferolaterally it consists of ligaments. This is a very short topic. You have to know blood supply. The urinary bladder is supplied by superior and inferior vesical arteries, which is a branch of internal iliac artery, and the venous drainage is through venous plexus. Okay, so it's very easy to remember that vesical means urinary bladder. That's why vesical venous plexus will be the drainage system of the venous drainage of the urinary bladder. The another thing is the ligaments of the urinary bladder. So there are some ligaments which are true ligaments which supports the urinary bladder, which holds the urinary bladder. So those are lateral true ligament, lateral puboprostatic ligament, and medial puboprostatic ligament. You have to know the, you just know the name of, you have to know what is the name of the ligaments only, okay, because it's very easy. The other two true ligaments are median umbilical ligaments and posterior ligament. Now obviously नाम से भी आपको पता चल रहा होगा कि lateral true ligament lateral side पे होगा, medial puboprostatic ligament मीडियल साइड पे होगा, जो लेटरल प्यूबोप्रोस्टैटिक लिगामेंट है वो लेटरल साइड पे होगा, ठीक है. नाउ प्यूबोप्रोस्टैटिक लिगामेंट ऑब्वियसली एज द नेम इंडिकेट प्यूबोप्रोस्टैटिक, तो प्यूबो निकला है प्यूबिक बोन से एंड द प्रोस्टैटिक निकला है प्रोस्टैटिक ग्लैंड से, तो that ligament will be present between them. That's why this is called as puboprostatic ligament. If it is on the lateral side, so lateral puboprostatic ligament, and if it is on the medial side, medial puboprostatic ligament. It's very simple. If I talk about median umbilical ligament, so I have told you that median umbilical ligament will connect the apex of the urinary bladder with the umbilicus, and the last one is posterior ligament. Posterior ligament, as the name indicates, it will be present on the posterior side, and it connects with the pelvis, wall of the pelvis and the bladder. This ligament is present between the wall of the pelvis and the base of the bladder. Now false ligament, ये false ligament होते हैं पेरिटोनियल फोल्ड्स. पेरिटोनियम जो है हमारी बॉडी में, जो एब्डोमेन में होती है, जो कवर करती है, वो फोल्ड्स बनाती हैं. अब वो फोल्ड्स ऐसा लगता है कि लिगामेंट से, बट दोज आर नॉट लिगामेंट. दैट्स व्हाई वी से दैट false ligament. They don't support the bladder, okay, and you have to just know the names, and you have to know what are the names of the false ligaments. So that are median umbilical fold, medial umbilical fold. First one is median, एंड में n आ रहा है, और second one is medial, एंड में l आ रहा है, and third one is lateral false ligament, and the fourth one is posterior false ligament. These are false ligament, not true ligament. These are false ligaments. These are the peritoneum folds. Okay, so this was the whole topic regarding urinary bladder. Till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.